one thing Obamacare did not do is address anything dealing with tort reform. And there are a series of 7 bills in the legislature dealing with tort reform. 2 of them, they've all passed the House. They're now in the Senate, and I'll be carrying 2 of them on the Senate floor, dealing with multiple defendants in medical malpractice cases and double recovery by plaintiffs in medical malpractice cases. They get a little deep into the weeds, but we have been told that with these 7 bills, it should lead to cost savings of at least 5%, maybe up to 15%, dealing with malpractice.
Probably one of the things that we hear all the time when we talk about healthcare reform, we've got to do 2 things, and why did the federal government do this? We've got to be able to buy insurance across state lines, and we've got to do something about tort reform. You heard a little bit about tort reform. I'll go into some more detail on that. The first bill I want to talk about is House Bill 445, which allows you to buy insurance across state lines. Now that really isn't a new concept. We already can do that, but the problem is if you buy an insurance policy from a foreign insurance company, meaning something outside of the state of Montana, you have to comply with all the mandates that we have in Montana, all the rules, all the regulations. And as was mentioned earlier, we have a lot of rules and regulations and mandates in Montana that make the health care quite expensive. So buying insurance across the state lines is one of the vehicles to do that. There is currently only one other state that has passed legislation to do that, and that's the state of Wyoming. So this is something that's just starting to catch on right now, but we still provide a real opportunity for taking and lowering the cost of insurance. The number of choices that you have just moving from Montana to another state is just almost unbelievable. Lots and lots more choices. The next bill I want to talk about is House Bill 183, and what a lot of these bills do, they are designed to take and insure the segment of our population that's the most difficult to insure right now. If you belong to a group policy or you have health insurance through your school or through the state or any kind of a government agency, those people are pretty happy about that. You have a lot of folks that are working on keeping the health costs low for you. But the segment of the population that just doesn't have anybody really watching out for them is somebody that's trying to buy an insurance policy on their own. And one of the reasons why I decided to become involved with this insurance situation, I worked for Sears for 32 years. When I retired, they told me, well, we're not going to be able to cover any of the expenses for your group health policy, but don't worry about it. You'll be able to get the same great policy, and all you'll have to do is pay the premium yourself out of pocket. And this was about 5 years ago. For me and my wife, our premiums are going to be $1,200 a month. So I figured out, that's something we can't afford in our budget. I'm a retired guy now. So we looked at the high deductibles, and the high deductibles were just about half the cost of a standard insurance policy. So a lot of these things that we're talking about here are designed to make high deductibles more attractive to individuals. House Bill 183 takes and provides cost savings by one of the first things we do that's not very exciting for the state auditor is we take the 2.75% premium tax and we leave it in the policy for a reduction. That 2.75 policy goes to pay CHIPS, it goes to pay for Insure Montana, it goes for the social programs. We think we're better off if we leave that with the individual to pay for their own insurance rather than trying to socialize it. The bill also takes and deals with if an employer wants to take and set up an account where they're going to take and pay for some of your out-of-pocket medical expenses, and as a benefit to the employee, that's not considered as income. So that's another way for the employer to help. We've got a benefit in there that allows you to get a deduction for each person that you sign up for one of these programs. We've got benefits in that bill to make it so that if you're living a healthy lifestyle, if you're doing your exercising, your weight's under control, you're not drinking, you're not a smoker, we don't consider that as an unfair business practice.
House Bill 526 is another interstate health care compact. These 2 bills take a little different approach to achieve the same thing. And I'll try to go fast since Sherry went over. Basically, they're 2 sides of the same coin. We need both of these interstate compact bills to get control of health care decisions back to Montana. Kerry's bill takes a legal approach, citing sections of the U.S. Code. My bill takes a political approach using Article 1, Section 10 of the Constitution to allow the states to collectively request congressional consent. My bill also returns the federal funding that Montana citizens pay into federal health care back to Montana to use as we decide. Again, an interstate compact is an agreement among several states that is enacted into law in each participating state. A few examples of interstate compacts adopted in Montana are the Interstate Library Compact, Interstate Compact on Juveniles, Interstate Compact on mental health, and Driver's License Compact. The compact is not a new concept. There are over 200 interstate compacts in use across the United States. House Bill 526 is Interstate Healthcare Compact. The purpose of this healthcare compact is bringing several states together, giving them strength of numbers and approach Congress together. Asking Congress to give the participating states the option to return all or a portion of federal health care regulation and the associated funding, which is the Medicare costs that we're sending to Washington, back to the participating states. A compact must be enacted in substantially the same form in each participating state, and we're now working closely with over 30 states to pass legislation to join the compact. The purpose of House Bill 526 is to give the participating states the authority to collectively ask Congress for consent to allow the participating states to pass future health care regulation that would supersede federal health care laws. The most important thing to understand is that House Bill 526 does not change or establish any health care regulation, policies, or programs. The states are not getting together to write new health care legislation. They're getting together to ask Congress approval to develop future health care programs within the individual states. The other important thing to know is it doesn't become effective until Congress gives consent and puts it into
a
effect.
constitutional amendment that says that no individual or employer can be required to participate in any particular health insurance plan. Just that simple, nor may they be fined or sanctioned for not doing so. So I asked my senator, Jim Shockley, if he put in the bill request for me, which he did. And because I'm still up for re-election, I'm not eligible to submit bills at that point. And so I introduced it. In this section is House Bill 206. And I'll read it to you. It's very simple. It's the right to choose health insurance coverage. All individuals and employers have the right to choose whether or not to purchase or participate in any plan of health insurance coverage. No individual or employer shall pay a fine, penalty, or fee, but be subject to civil or criminal sanction for exercising the right to choose whether to purchase or participate in health insurance coverage. A health care provider shall not pay a fine, penalty, or fee, or be subject to civil or criminal sanction for accepting direct payment for health care services from an individual or an employer on behalf of an employee if the individual or employer has exercised the right to choose whether to purchase or participate in a plan of health insurance coverage. That's it.